Good morning, dear students. Today we will discuss how do we Worksheet-73 from 73 from your chapter Why Do We Fall Ill? And today we will discuss the types of diseases. Okay, one of Gyan's friend is suffering from the tuberculosis, so he wants to know what kind of disease it is actually. So Didi explained the diseases like tuberculosis, diabetes, thyroid, cancer, they damage the health badly and they cannot be treated in a few days. Such diseases last for a longer duration of time, and those diseases which are last for longer duration of time are called as chronic diseases. So basically we divide the types of diseases into two, like chronic as well as acute diseases. Chronic diseases last for longer period of time, whereas acute diseases last for shorter duration of time. Okay, these are more severity. If we talking about the severity, these are more severe for short time. They are less severe for longer time, but they affect more. They affect more to patient or to person, whereas they affect less, right? Means what? Chronic diseases are those diseases which last for the longer duration of time, like diabetes, thyroid, cancer, tuberculosis, heart problem. But whereas common cold, cough, fever, headache, they last for the shorter duration of time, and why this is why they are called as acute diseases. Because severity of disease in case of acute diseases is more, whereas the severity of in chronic diseases is less. So they do not cause any permanent damage to the body. These acute diseases cannot damage much to the body, whereas these chronic diseases they affect body uh, they affect a person's body rather in more way. Okay, so another form of disease is communicable and non-communicable. Communicable diseases are those diseases which spread from one person to another person. One infectious person, okay, from one infectious person to a healthy person. So communicable diseases are also called as infectious diseases. They are caused by some microbes called pathogens. These diseases are spread by air, water, and from infected person to the healthy person through the causative agents. And which are causative agents? Like bacteria, virus, fungus, and protozoa. So let us know about the bacterial disease. Which are bacterial diseases? Typhoid, cholera, tuberculosis, anthrax, they all are bacterial diseases in which staphylococcus bacteria causes even acne. Viral diseases like cold, influenza, COVID, dengue, AIDS, they all are viral diseases. And SARS virus causes the acute respiratory syndrome. Even COVID-19 is one of the strain of this SARS. Fungal diseases. Many mainly fungal affect our skin. Okay, so many fungus causes the skin diseases and skin infections. Protozoan diseases. Malaria, kala azar, like Plasmodium vivax, protozoa causes malaria, and Leishmania causes kala azar. Next, we have non-communicable diseases. Non-communicable diseases are those diseases which do not transmit from one person to another person, like high blood pressure, diabetes, cancer, cataract. These diseases cannot spread from one person to another person. See, even in your family, if any of your family member is suffering from blood sugar, it is not contaminated disease. It is directly cannot spread from one person to another person. If you share their food, if you share their clothes, it cannot be spread at all. So these are the diseases called as non-communicable diseases. Non-communicable diseases are caused by unhealthy. This is the main problem of non-communicable diseases, basically unhealthy lifestyle, improper functioning of some internal organs or glands, or undernutrition, or the deficiency of some nutrients, or age factor is also one of the major cause of non-communicable diseases. Okay, whenever we have any disease, our body starts responding to it, form a sign and the symptom of the disease. For example, headache, loose motion, cough, fever. These are the diseases we show the symptoms. These are not the disease, these are the symptoms, signs and symptoms through which one can diagnose that somebody is suffering from some disease. Like if we have some headache, then it must be related to our nervous system. If somebody has loose motion or diarrhea, it is related to our stomach infection. Cough and cold is related to the chest infection, right? And fever show that there must be some infection exist in the body. And symptom like COVID and swelling in neck are the symptom of goiter diseases. Okay, so the tissue of the organ which cannot affect then start malfunctioning and give the sign and the symptom of the diseases. In these conditions, the tissue of the organ affect and start malfunctioning. Okay, see, what are acne and chronic disease? Acute and chronic diseases? You can write the definition of this chronic diseases and acute diseases from here. This is the answer of your first question. What is communicable diseases and how they spread? This is communicable diseases. This is how they spread. You can write the answer of this question. Some communicable diseases with their microbes. So you get the answer from here. So this is a complete answer of your second question. Third, what are non-communicable diseases? Give their example. Non-communicable diseases are those diseases which cannot be spread from one person to another person. This is the answer of your third question. These are some examples. Okay, high blood pressure, sugar, diabetes, cancer, high blood pressure, thyroid, etc. Yes, COVID an acute disease? Explain. Yes, COVID is an acute disease. It spread very rapidly from one person to another person, and also it take, 15 to 21 diseases. Maybe the severity of diseases more. Okay. So this is all about your today's worksheet. I hope you understand it. Thank you, bache. Take care.